Understanding Stroke, a physical therapy perspective. And you can start whenever you're ready.
Take a moment and imagine your typical day. You're driving to work, cooking dinner, maybe standing in line at the grocery store. When all of a sudden, you suffer a stroke, a brain bleed, injuring your brain to the point where you can no longer walk or talk. You can't feel one side of your body. It takes all of your energy just to sit up in bed. It feels as though your life has been taken away. How do you reteach your body to move again? This is the job of your physical therapist. Most patients who experience a stroke will begin a rehabilitation program involving physical therapy. But PT isn't the only therapy you need. There's speech and occupational therapy, physician's visits. You may need a prescription medication or a wheelchair. And all of these things cost time and money. In order to provide the best care possible, we must have a thorough understanding of both the physical and financial needs of those experiencing disability after stroke. We know services like physical therapy are needed in stroke recovery, but how much do you need? How often do you need it? And are we under or over treating our patients today? These questions are at the heart of my research. I want to explore the relationship between the amount of physical therapy a patient receives and the extent of their recovery after stroke. In my research, I'm creating a database of all patients receiving treatment from Swan Rehab, a PT clinic specializing in neurological rehabilitation. Using de-identified data collected from the clinic's electronic medical records, I can get a big picture look at the amount of physical therapy a patient receives per week, and then compare this to improvements made in their rehab, like balance, for example. And I can track these changes from beginning to end of therapy. My results indicate this sweet spot, where improvements made in balance, walking speed, and walking endurance occur most often when patients receive 60 minutes of therapy at least twice a week for 4 months. Patients seen less frequently than this tend to have worse outcomes, while patients seen for more therapy seem to reach a plateau in their recovery. My results not only expand our understanding of optimal care after stroke, but also shed light on the need for accessible physical rehabilitation services to help people take back their lives. Because ultimately, we can't control who may experience a stroke, but we can control how we treat them in their journey to recovery. Thank you.